Brain tumor. Did you know that every year, nearly 90,000 Americans are diagnosed with a primary brain tumor? That's shocking to me. It's about the entire population of a small city receiving this life-altering diagnosis every single year. And here's something even more shocking. According to the American Brain Tumor Association, brain tumors are the leading cause of cancer-related deaths in children under 14 and young adults under 40. The human brain is a marvel, but when something goes wrong, the consequences can be devastating. Brain tumors often start silently, lurking undetected, until they begin to interfere with critical brain functions. Some symptoms mimic harmless conditions, causing people to ignore them until it's too late. In today's video, we'll explore the causes of brain tumors, the early warning signs you absolutely cannot ignore, and the treatment options that offer hope. Make sure to watch until the end, because knowing these facts could one day save your life, or the life of someone you love. So, what causes brain tumors? As far as I know, science still hasn't pinpointed a single direct cause. Instead, researchers have identified a range of risk factors that can increase the likelihood of developing a brain tumor. Genetics plays a role. If you have a family history of brain tumors, you may have a higher chance of developing one yourself. Certain inherited conditions, such as Li-Fraumeni syndrome or neurofibromatosis, are linked to an increased risk. But what about environmental factors? You may have heard concerns about cell phones causing brain tumors. So far, research hasn't found a definitive link between mobile phone use and brain cancer, according to the National Cancer Institute. However, long-term exposure to high doses of ionizing radiation, such as radiation therapy to the head or occupational exposure in certain industries, has been proven to increase brain tumor risk. Other factors, like exposure to harmful chemicals, are still being studied, and some experts suggest that air pollution and pesticides could play a role. One of the biggest challenges with brain tumors is that they often remain undiagnosed until they've grown large enough to cause noticeable symptoms, and by that time, they can be much harder to treat. That's why understanding the early warning signs is so crucial. Headaches are one of the most common early symptoms, but not just any headache. Brain tumor-related headaches tend to be persistent, more severe in the morning, and worsen when you cough, bend over, or perform any activity that increases pressure inside your skull. If your headaches are new, becoming more intense over time, or don't respond to usual pain relievers, it's worth getting checked out. Seizures are another major red flag. If you've never had seizures before and suddenly experience one, this could be a warning sign of abnormal electrical activity in the brain caused by a tumor. Other symptoms include unexplained nausea and vomiting, blurry vision, balance problems, and sudden personality or cognitive changes, like memory loss, confusion, or difficulty concentrating. And that has terrified me. Here's a real-life example that brought this issue into the spotlight recently. Teddi Mellencamp, a reality TV star best known for The Real Housewives of Beverly Hills, was diagnosed with stage 2 melanoma, a serious form of skin cancer. After initially dismissing irregular spots on her skin, later, she revealed that doctors also found abnormal growths in her brain. Her case is a stark reminder that cancer in one part of the body can sometimes spread to the brain. In fact, about 30% of all cancer patients will develop metastatic brain tumors, meaning their cancer has spread to the brain from another organ. Her story underscores the importance of early detection and regular medical checkups. Even when symptoms seem minor or unrelated, she's just over 40, so young. So, how do doctors diagnose a brain tumor? The process usually begins with a neurological exam, checking your vision, reflexes, coordination, and balance. If a tumor is suspected, an MRI or CT scan provides a detailed image of the brain, allowing doctors to see any abnormal growths. In some cases, a biopsy is necessary. This involves taking a small sample of the tumor tissue to determine whether it's benign or malignant. Not all brain tumors are cancerous. Benign tumors, such as meningiomas, grow slowly and may not always require immediate treatment. However, malignant tumors like glioblastomas are highly aggressive and require urgent intervention. Glioblastomas are particularly deadly, with an average survival time of only 12 to 18 months, despite treatment. Now, let me talk about treatment. Surgery is often the first step, but it isn't always possible to remove the entire tumor, especially if it's in a delicate area of the brain. That's where radiation therapy and chemotherapy come in. Radiation therapy uses high-energy beams to target tumor cells, while chemotherapy involves drugs that kill cancerous cells or slow their growth. One of the most exciting advancements in brain tumor treatment is immunotherapy, using the body's own immune system to fight cancer. Researchers are also exploring targeted therapies that attack specific genetic mutations in tumors, offering a more precise and less harmful approach than traditional chemotherapy. For those living with a brain tumor, life can feel like an uphill battle. Cognitive and physical impairments can make everyday tasks challenging. Rehabilitation services, such as physical therapy, occupational therapy, and speech therapy, can help patients regain lost abilities and maintain their independence. Mental health is just as important. Anxiety, depression, and fear are common among brain tumor patients, and seeking support, whether through counseling, support groups, or simply talking to loved ones, can make a world of difference. As Dr. Susan Chong, a neuro-oncologist at UCSF, puts it, the brain is who we are. A brain tumor doesn't just affect the body. It affects identity, emotions, and personality. There's still so much we don't know about brain tumors, but one thing is certain: early detection saves lives. That's why I believe regular checkups and paying attention to unusual symptoms are so crucial. If you or someone you love is experiencing persistent headaches, unexplained seizures, or cognitive changes, don't ignore them. See a doctor. The sooner a tumor is detected, the better the chances of effective treatment. The fight against brain tumors is ongoing, and with advances in medical research, there's hope on the horizon. Scientists are currently studying promising treatments like CAR T-cell therapy and tumor-treating fields, which use electric fields to disrupt tumor growth. These innovations could change the future of brain tumor treatment forever. Before we wrap up, let me recap. Brain tumors don't always show obvious symptoms at first, which makes early detection difficult, but essential. Persistent headaches, seizures, vision problems, and cognitive changes are all warning signs that should never be ignored. While the exact cause of brain tumors isn't fully understood, genetics, radiation exposure, and environmental factors all seem to play a role. The good news is that advancements in treatment, such as immunotherapy and targeted drugs, are offering new hope to patients. Thank you for watching. If you found this video informative, please give me a thumbs up and subscribe to this channel for more health-related insights. And before you go, let me know in the comments, where are you watching from? Stay healthy, stay informed, and I'll see you in the next video.